a few things that we use here as tools. Firstly, the question of blood tests. So for an individual who's jaundiced, we'll look for an elevated bilirubin level. That's the index of jaundice. That would be a common thing we might find. We'll also check something called tumor markers. These are blood tests associated with CA19-9 or CEA. These are, I would say, not exclusive to pancreas cancer, and they're not blood tests that are specific enough in terms of being used as a screening test for this disease, but we'll use them to support a diagnosis and often to follow treatment as it is underway. In terms of imaging, perhaps the most common initial test that most people will have who present with jaundice is an ultrasound, and that will often show that the bile duct is obstructed, and that will prompt a CT scan. Typically we'll do something called a CT pancreas angiogram, including the rest of the abdomen and including the pelvis, where an individual will drink water or an oral contrast agent and receive an intravenous contrast agent. And that delineates what's going on in the pancreas. We can see fine cuts through the pancreas that can identify a small tumor. In particular, with the eyes of thinking about whether or not this can come out, if there's an abnormality there, we'll be looking at what the relationship of that tumor is to critical blood vessels like the celiac artery, the superior mesenteric artery, and the superior mesenteric vein. And of course, looking to see if there's any evidence of spread of the cancer to other places. And the common areas here would be the liver, lymph nodes, the inner lining of the abdominal cavity, that's called the peritoneum, and lungs. They would be the main areas where pancreas cancer can potentially metastasize to. So with that, the next step is to secure a firm diagnosis, and a usual way of doing this is with a test called an endoscopic ultrasound, or an EUS. This is an outpatient procedure. It's like having an upper endoscopy with a little camera on the end, and we pass a fine needle through that camera and take a sample of the pancreas. Occasionally, we'll ask our colleagues in interventional radiology to use a needle across the abdomen directly into the pancreas. And sometimes we'll actually make that diagnosis at the time of surgery if the imaging and the clinical presentation is very suggestive that pancreatic cancer is the underlying diagnosis, that an individual will go direct to an operation.